Assalamualaikum and a very good morning. My name is WARDAH HANIM binti Muhammad HAZIDAN. My metric number is 1911028, and today I will be presenting a journal article entitled The Acceptance of COVID-19 Vaccination During the COVID-19 Pandemic in China. This article was published on 27th August 2020. There are 7 writers for this article. Well, the purpose for this research being made is because of the hesitancy and delay regarding vaccination among people, even among those who had intended to get vaccination. Although great progress has been made, there are still important challenges regarding future immunization against COVID-19 in China, one of which is the uncertainty about the public acceptance of COVID-19 vaccination. The objective of this research was to assess the Chinese adult acceptance of potential COVID-19 vaccination, as well as their preference for vaccine attributes and vaccination schedules. The influencing factors on vaccination acceptance. This knowledge is important to develop an effective COVID-19 vaccination plans and immunization initiative in future. To find the factors that influence vaccine acceptance, the researchers used multivariation logistic regression. The research question collected socio-demographic characteristics, risk perception, the impact of COVID-19, attitudes, acceptance, and attribute preference of COVID-19 vaccination during pandemic. The aim of this study was to determine COVID-19 vaccination acceptance in China and make recommendations for vaccination strategies and immunization programs based on the findings. The general purpose of this study is to expand the vaccination coverage by giving health education and communication from a reputable organization, because these are the most effective way to ease public fear regarding to vaccine protection and immunization policies. The population or sample that been used in this study is adult in China. The duration of this study is from March 2020 until July 2020. The geographical location covered in this study is only in China. The gap that trying to be filled from the previous issues regarding to the influenza vaccination, there are no analysis regarding to doctors' recommendation. Therefore, in this research, they wanted to add on believing in efficacy of COVID-19 vaccination and valuing doctors' recommendation, where it could be increasing the probability of accepting COVID-19 vaccination among China's adults as soon as possible. The research methodology from the survey. The research design that had been used for this study are sampling, measures, and statistic analysis, and the instrument used to do the research was online survey, where the sampling collected from socio-demographic characteristics, risk perception, the impact of COVID-19, attitudes, acceptance and attributes, preference of vaccine against COVID-19 during pandemic, and also they analyzed the data by grouping the result into 2 sections, which the first one, the person who want to be vaccinated, and the second one, the person who doesn't want to be vaccinated. As a conclusion, this study reflected a high level of acceptance of COVID-19 vaccination among the adults in China during pandemic period. Concern regarding to vaccination safety among public might curtail the potential of COVID-19 immunization effort. Immunization programs should be structured to eliminate obstacles in vaccine, and vaccination should increase uptake in response to the COVID-19 pandemic. I think that's all from me.